Hello everyone. Welcome to Lify Life, painful periods, norm or deviation. According to statistics, more than 90% of women around the world experience some form of discomfort during their menstruation. Against this background, the fair sex also develops psychological problems. Young girls and mature women begin to associate menstruation with pain. This, in turn, provokes an increase in discomfort. Painful periods, normal or not? Let's look into this issue. Consider what can provoke discomfort. We will determine in what situations you should consult a doctor. Painful periods, causes. To determine why discomfort occurs during menstruation, it should be done together with a gynecologist. Only he can examine the patient and prescribe the necessary examination. This will allow you to find out why painful periods occur. Interestingly, several variants of the development of the problem are possible. Pain accompanies all menses, starting with the first. In this case, the gynecologist will have to identify structural pathologies. Usually they consist in congenital anatomical or acquired changes. At the same time, discomfort occurs when menstrual blood cannot leave the uterine cavity in the standard mode. The pain appeared sometime after the start of menstruation. It usually takes 4-6 months from the first period to the first painful menstruation. This period is explained by the fact that it is at this time that the cycle is supplemented by ovulation. The cause of discomfort is sought in the hormonal level in general and in its possible changes. Prostaglandins play a major role in causing pain. They provide contraction of the uterine wall. If disturbances occur, the synthesis of these hormones increases as menstruation approaches. This causes increased contractility of the uterine muscle and compression of the vessels. All this leads to discomfort. Changes in the level of prostaglandins can provoke not only pain, but also diarrhea, nausea, vomiting, even an increase in blood pressure. Usually in these cases, women are prescribed combined oral contraceptives. They allow you to block ovulation and eliminate pain or make it less pronounced. But such therapy is effective only if prostaglandins are to blame. What about other hormones? It also requires a comprehensive examination. Pain during menstruation occurred at a certain age. In this case, the work of the gynecologist is aimed at finding diseases that could cause discomfort. Pain is usually caused by inflammation and endometriosis. During a comprehensive examination, other pathologies can also be detected. It should be understood that discomfort can be provoked by natural factors. The main one is spasm. The uterus contracts as it sheds the endometrium. Pain, dysmenorrhea, can be a sign of various disorders. The main ones include disruption of hormone synthesis, neurological disorders, low pain threshold, fear of menstruation, etc., magnesium deficiency in the blood, congenital anomalies, malformations of the uterus, its atypical position, underdevelopment, etc. Vascular disorders. Important. In some cases, it is impossible to find out the cause of painful periods in women. At the same time, at the moment, experts have identified several factors that increase the risk of discomfort. The main ones include age over 20 years, heredity, absence of childbirth, smoking, irregular cycle, heavy menstruation, early, before 11 years, puberty. When should you see a doctor? Not always painful menstruation is the reason for contacting a gynecologist. If a woman experiences slight discomfort, do not panic. If the pain occurred in only one cycle, there is also no cause for serious concern. You should contact a gynecologist if the discomfort is estimated at 7, 8, 9 points on a 10-point scale. They seriously limit activity, do not allow you to leave the house, and force you to stay in bed. This not normal. You should make an appointment with a doctor if the pain is accompanied by passage of large blood clots, diarrhea, nausea and vomiting, dizziness, various symptoms of anemia, weakness, drowsiness, etc. A mandatory examination by a gynecologist is if discomfort occurs after the installation of an intrauterine device, the start of taking combined oral contraceptives, and the onset of sexual activity. Also, the help of a doctor is required for discomfort in the lower abdomen and between menstruation. The gynecologist will determine why the pain occurred during menstruation, and eliminate the existing pathological processes. Important. It should be understood that discomfort can be a sign of dangerous infections. In this case, therapy should be started as early as possible. If this is not done, adhesions may appear that damage the pelvic organs, with a further development of infertility. You need to see a doctor as soon as possible if you have a fever, a sudden increase in pain, a foul-smelling copious discharge from the vagina. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Hope seeing you back on Lify Life.